All right, so this is our first monthly meeting, our bi-monthly meeting for Statewide Afterschool Network. Just to remember, these are our collective group agreements. Please take a moment, just reflect on those group agreements, find one that you want to hold as your attention for today's meeting time. And we will go ahead and get started. Thank you all for joining us. We have several kind of we have several big items on our agenda, and we have some just housekeeping ones as well that we want to touch base with you all about to keep you all in the loop. Our first one underneath our network business that we want to let you know, we are moving. Our office is moving further down the street. We currently are on C Street. We're moving further down into Midtown. So that is the new location of our office. Not that many of you stop by our office, especially now during the pandemic, but do recognize if you're trying to reach us or if you have any files for any type of accounting purposes and that, we will be moving. We'll have mail forwarding for the first 6 months. But just as a heads up, you will be seeing some communications coming from us of a new location. Also, we want to let you know that starting on Tuesday of this week, we have a new AmeriCorps Vista member who is starting. We are thrilled to bring Bethany on board. She's going to be our substance misuse prevention Vista member. Her work will focus around really looking at the role of after school and substance use prevention. She'll help expand the use of Narcan to prevent overdose deaths in the community. She will also be working with many of you on healthy lifestyles, the marijuana education prevention curriculum that we've been supporting around the state, and doing several other kind of key projects around elevating after school and substance misuse and that connection together, including things like Red Ribbon Week in the fall and other kind of key dates. That is going to be her new email address. Feel free if you want to give a preemptive welcome to the team to Bethany. I'm sure she would love that on her first day. It's going to be AmeriCorps1@alaskachildrenstrust.org. So those are just some quick housekeeping ones that we want to let you know that are happening. In terms of our new business, so we have several things on our agenda. We have Barb Pennington, the school health nurse consultant, also our most recent after school champion from this year's conference, is going to be giving us an update. I've been receiving a lot of emails and some calls from partners around the state around the variant and around what that looks like and what are some of the updates, especially with changes in CDC guidance around quarantines and isolation periods. So Barb's going to be sharing more about that. We want to speak about a new partnership we have as a National After School Association affiliate and what that means for all of you, and would love your input as to how we can help expand those services to you. Lily is going to jump in and share about our STEM needs assessment that we are launching today. We have we're going to be forming a new licensed school age childcare work group, really looking at addressing some of the systemic issues that have prevented licensed school age childcare programs from expanding. And then we have as well, we're going to share, we have a lot of professional development coming up the next 2 months. Erin and Anna are going to tag team share some of those opportunities. And we'll have an opportunity for all of you, of course, to share any opportunities, news, highlights that you have. Throughout the course of the workshop, especially during Barb's part, if you have questions, please feel free to chime in or put in the chat box about that. And we always welcome those type of conversations. So I am going to turn it over to Barb, and Barb, I'm going to pull up your slide deck for you. I thought that might be a little easier.
I'm excited to be here. It's been quite a wild ride, hasn't it? We've been going on, it's going to be like 2 years now. I remember I was in Hawaii like 2 years ago, Thomas, and my girlfriend and I were there, and we were leaving from the airport in Kona, and I saw my first mask, and I had just heard about COVID. It was like the 3rd week of January. And I was like, oh, that's interesting. Somebody's wearing a mask, and little did we know that everybody in airports would be wearing a mask very soon, and it would be hard to get to Hawaii. So I'm glad you are suffering there in your quarantine That was so, but I'm going to go over some slides. We showed these on the School Health Echo on Monday, and I added just a couple extras to that. So if those of you that do get on that, it's awesome presentation, 3 o'clock on Mondays, 3 to 4. It is recorded, so you can watch it later in case you're watching kids during this time, which you probably are. Okay, next slide. So you had some questions about Omicron. Everybody does. So it is actually the most prevalent variant right now. It's estimated to be about 95% nationally, especially in Alaska too. We've been seeing an increase of cases. Next slide. So this shows our daily rate, and this is a little bit behind. It was January 7th, I think. Anyway, so as you can see, that's really going up high with the Omicron variant. The good news is it doesn't seem to be quite as serious with hospitalizations and deaths as the Delta variant was. Next. So this is how our cases in Alaska are looking, and it is similar to what's happening nationwide. So there's a big spike, and if we're going to be like South Africa was or New York is, there was a spike downward. So that is my hope that we've increased a lot, but hopefully in the next couple of weeks we're going to start to see a decrease again. Next. So this is where we're at in Alaska right now. Our amount of people that are hospitalized is not as high as it had been, and the amount of people on ventilators right now is not as high, but we have just peaked the last 2 days at the highest case rates ever in the state. So next slide. How are children doing with COVID right now? So this is children and COVID in the US in the past week or so. So as you can see, the rates are going up for adults, and they're also going up for children. The children is the darker blue underneath there. Next. So children in the US, the cases as you see, have gone up quite dramatically. Omicron is affecting the children more than the other variants did. Next. And I might add, it's actually helping vaccination rates of children around the country. We're seeing that more parents are choosing to get their younger children, the 5 to 11-year-olds, vaccinated. We've had a pretty good rate of those that are teenagers. But if you look at this in the dark blue, 68 of our residents in Alaska, 68.2%, have received at least 1 dose of a vaccination for COVID. And 60% have completed their primary series, and 23% have received a booster. Now that could be that some are in the waiting period, or maybe some have chosen not to get a booster, but boosters are really effective against the Omicron. So if you look at the bottom of the slide, the residents 5 to 11 that received at least 1 dose, we're only at 22%. Now I'm hoping that's going to be rising if we're following a national trend that more parents are going to get those younger kids vaccinated. Vaccination status who've completed it in that age group is 16.5%. And you can go look on our dashboard and see if the area that you're in, how the kids are doing. Residents that are teenagers 12 to 18 are a high percentage here, 55.7, and there's 50% that have completed their vaccination status. And I want to say that we are considering any of our children under 18, if they've received at least 2 doses, that they're fully vaccinated, although they can receive a booster if they're at least 12. Next. So who should get a booster? So if you have had at least 5 months since your primary series that was just changed about a week ago, and not 6 months, you can get another dose of Pfizer or Moderna. And if you are a severely compromised child, then you can get a dose, a booster dose. Basically, you can get like a 3rd dose. So that's something that's available to our kids that are, very compromised. So they can get that after 28 days. And the US Food and Drug Administration has just recommended the Pfizer booster for those aged 12 to 15, so they can start getting boosted. Next. So do you qualify for a booster? I would highly recommend any of you that are working with children, if you have had at least 5 months since your primary series, to go ahead and get a booster. And the current recommendation isn't on here, is to get Pfizer or Moderna. We found that the Johnson & Johnson is not quite as effective as the other two are. Next slide. How effective is this vaccine against the Omicron? So this is a really important slide, Thomas, if you want to kind of point to the dark squares up there, that's Delta. How effective was Delta? And so we're looking at the time since vaccines. Now look at Omicron. So if you look at the bottom there, like the fourth over, it's only 35% or so, 37% effective with 2 doses after a period of time, after 24 or 25 the days. I'm trying to see if this, yeah, this is weeks. So what's happening is that these vaccines are not working as well against Omicron. But however, if you look at the last circle there on the far right, it is working if you get a booster. So that's why I would encourage all of you. It's looking about 75, 78% effectiveness if you have the booster after 5 months. Omicron versus Delta, as you can see, there's just a little comparison there. Okay, next slide. So things you should know: vaccines and booster shots are the best protective measure that we have right now. One of you asked how are we doing with Omicron? Is it still worth it? Yes, absolute mitigation procedures are still worth it with Omicron. We do have monoclonal antibodies available. The ones that are working best against Omicron, we are in short supply nationwide and in Alaska. So if you are in a category of being more immunocompromised, maybe you have some chronic illnesses, if you become COVID positive, call your doctor and ask if you would be one that should get monoclonal antibodies. They've actually saved a lot of lives and kept people out of the hospital. And we do have some new antiviral drugs that need to be taken within 5 days, just like flu, just like influenza. You can have an antiviral drug for that, but you need to take it right away. And we are seeing more cases of influenza coming up this season compared to last year. So if you've tested positive for COVID and you're experiencing symptoms, talk to your healthcare provider and ask if there's any medication that you might be able to take. Next. So this is some really good guidelines for you to have and to just have it on your desktop there, to refer to. I've had calls around the state from different preschools and daycare centers, and they want to know what can they refer parents to. There has not been new guidelines yet for the preschool age under kindergarten, but we're waiting for that from CDC. So if you look, Thomas, if you want to click on the first one there, I don't know if that'll work from your computer. Actually, the second one maybe would be better. Yeah, the overview of isolation. So I just want to take you to this so you can see basically what is there. So this is a great bookmark that you can have to show your parents, refer to yourself if you don't have a copy of these slides. So this talks about like, what is isolation and who needs to isolate? And you can go down a little bit. How long should a student or staff member with COVID isolate? So if you look at that, this is what you can greatly refer to. It answers a lot of questions and gives the current information. Okay, you can click out of that and we'll go back to the slide. So I would make sure that you have, you have those handy. That'll help you with, you will get questions from parents and they will question you. Okay, next slide. So let's talk about the difference between quarantine and isolation. I always remember that you think of I as illness, and that's one way that you can really keep these two apart. So if you're positive for COVID, you're ill. So that would mean isolate. You isolate when you're sick or you've been infected with the virus. Quarantine is if you were exposed and you need to stay away from others when you've been in close contact with someone. Next. So quarantine guidelines for those who are not up to date on COVID vaccines. That would mean if you were past 5 months since your primary series, your first and second, or if you just had the J&J, the 1 dose, or basically if you're not boosted. So you would fall in this category where you need to quarantine at home for at least 5 days. Stay home. You should wear a well-fitting mask if you must be around others, even in your home, and you should get tested right away. If you've had close contact with someone, at least 5 days after your last close contact, we encourage you to get tested. These are CDC guidelines, and most schools have adopted this. This is school guidelines. Not every school. You might be in a program that hasn't, or maybe you're in a private after-school program and your program has chosen not to adopt these. I've had some private schools that haven't, and they've stuck with the 10 days. But after quarantine, so you want to watch for symptoms until 10 days after you last had close contact with someone. If you develop symptoms, you need to isolate immediately and get tested and continue to stay home, okay? But if you have had 5 days at home, you have no symptoms, you don't have a fever, you can go back to work, go back to school with a well-fitting mask, but you must continue to wear that mask for 10 full days after you were first exposed. You should avoid travel, and we're also recommending that you don't do extracurricular activities, being around a lot of people out in the community. Next. This is a quarantine guideline for those who are up to date. So if you look at the left, that is if you were exposed to COVID-19 and are up to date, meaning that you've been boosted, or if you were a teenager, you're under 18 if you've had your 2 doses, or if you've had COVID-19 in the past 90 days. So Thomas, you're going to be good for 90 days now. So you don't have to quarantine again if you're exposed to someone. So you don't have to stay home unless you develop symptoms, but you should be wearing a mask this whole time. You should get tested even if you don't develop symptoms around day 5. So both of them we recommend if you're isolating, if you're positive, and if you're, well, actually, if you're not vaccinated or if you are vaccinated, you should still get tested around day 5. So you want to watch for symptoms for 10 days. And if you develop symptoms, you need to isolate immediately. But you want to continue to wear that well-fitting mask, the mask that feels good, fits good without any gaps around the sides for a full 10 days. And you should avoid travel again and being around people that are high risk. So how do you calculate that? So at the bottom, it says the day of your exposure is considered day 0. Say, today I got exposed to Thomas. He was positive. Tomorrow I start my day 1, and it's my first full day that I'm going to have to isolate or quarantine, sorry. And if I've not vaccinated, I would need to stay home for those first 5 days. Next. Universal masking is still recommended. That was one of your questions. It continues to be one of the best mitigation efforts that we have in school and after school programs. The consistent use of correct face masks. We've had questions asked about what about lunchtime, and you do the best if you're giving snacks to kids to, they can have their masks off during the time they have snacks, and as soon as they're done, mask up again, because they're usually in closer proximity when they're eating rather than when they're playing and being outside. So it does reduce transmission a lot. We found last year that kids weren't even getting the common cold because almost every school was masked. And so there's a difference this year with some of the schools not masking universally. Next. So isolation guidelines, regardless of vaccination status. So if you do test positive for COVID-19 or you have symptoms, like you have symptoms and you're presumed that you have it, maybe you don't have access to a test. You want to stay home for at least 5 days and isolate from others in your home if you can, and wear a well-fitting mask, even in your home. That'll protect the others. Ending isolation if you've had symptoms. So end isolation after 5 full days. If you're fever-free for 24 hours without the use of, say, Tylenol or ibuprofen, and you can, if you did not have any symptoms. And if you are severely ill, you should continue to isolate for 10 days. So you want to talk to your doctor about that. And you want to continue to wear a mask for the time day 6 through day 10. If you're not fully well, you should not be coming back to work. But CDC changed this to allow more people to get back into the workplace. And they found that there's about 31% of people are still positive after day 6. And it goes down to about 15% by day 8 or 9. And but wearing a well-fitting mask is really very protective, and that should stop the spread. We just have having, as you know, air travel has been affected. Schools are having a hard time staffing with their teachers. So this was something the CDC came out with. And they also found that there's not as many people that spread at the end of that period, the day 6 through 10. Next. Test to stay. Maybe you're in a school setting, your after school programs in a school, and maybe some of those students are in the test to stay program. And this is just something that CDC came out with, that the school can have those kiddos that normally would be quarantining at home be able to come to school, but they're testing on a regular basis. So it's recommended that they do a test at least twice during that first 5 to 7 days. And they can continue to come to school as long as they're not positive. And there's more information about that if you'd like that. Next. Where can you get a test? I think most of you by now probably have a good idea where you can get one in the community. We have been distributing the over-the-counter test. The warehouse has gotten more of those in. There is still somewhat of a short supply. Most of the schools around the state have been having some kind of testing, either contracting in or available in the school. Airport testing is going to be ending January 31st and transitioning to more community testing or the at-home antigen test. And the at-home antigen test, some of you may have gotten them. The airport's been giving them out too. They're relying on parents to contact the schools or the after-school programs and let them know if their student was positive. And what I hear, that's been pretty effective. Next. Test kits are available. Schools can still order them. The over-the-counter tests, they can still be ordered. The K through 12, you can actually order them for your after-school programs too. We just got more of the Buy Next Now cards in, and those are a lot simpler to use. Everybody I've talked to that's done a lot of testing prefer those over the Care Start. It's just a little, doesn't take quite as much time to use. Next. So we're going to focus on Healthy You in 2022. And next slide. I'm actually kind of hopeful because what I see is the Omicron variant is kind of, what word do I want to use? It seems to be not as harsh, not as, it is more transmissible, but the common cold is actually a coronavirus. And so I'm seeing that these variants hopefully will start to be less and less causing less death, causing less hospitalizations, and people will not have as many symptoms as they did with the first couple ones. So these are some of the questions that you'll ask. And I'm going to have, how many do we have on here, Thomas? How many people? I'm going to let people unmute and see if you can answer these, because I answered all these in my presentation. Okay, so how long should a student or staff quarantine if they're close contact? So we want to answer that?
You can also put it in the chat box.
Okay, so somebody want to be brave? Okay, so how long should they quarantine? 5 days, correct, 5 days. You heard well, okay. So if they are vaccinated, they actually fully vaccinated an adult with a booster, they actually don't even have to quarantine. But if they're not fully vaccinated, then they need to quarantine at home for 5 days. Okay, how long should students or staff quarantine if they're positive for COVID? And they don't have a fever. How long would that quarantine be? Anybody want to answer that one? Do we have any new answers? I can't see. That's going to be 5 days again. So 5 days from the positive test, correct, Courtney? So say you get exposed or you test positive is your day 0. Your day 1 starts the next day. So counting, say you were had a positive test on Sunday, then you quarantine Monday, Tuesday, Wednesday, Thursday, Friday. You could go out in public with a mask on. You guys have been listening. Okay, if someone tested positive for COVID less than 3 months ago, are they considered in the same category as vaccinated? What do you think? Yes, they are. So they would be in that same category. They could come to school, come to work. Correct. How long are you immune after having COVID? The latest that we know is what? How long are you considered? It's kind of like the same question. Correct. 3 months, 90 days. Correct. You guys listen. That's awesome. Okay. With how contentious Omicron is, are masking and distancing still important? Absolutely. It's actually even more important because it's being transmitted between 1.5 and 2 days. And wearing CDC is really recommending really protective masks, especially when you fly, like if you have access to the KN95, so the 95, when you're in places where you're in high transmission areas. So absolutely, it's still important. Okay, what questions do we have? That's it for the slides, Thomas. Thank you so much for doing that. What other questions haven't I answered?
I have a question. This is Jessica down in Juneau. Can you hear me?
Yes.
Oh, okay, great. So I got 2 young kiddos. We're all vaxxed and boosted, and they had a close contact who developed COVID, teenage contact. Anyway, so that means that I have a 14-year-old who got 3 tests in a week because of anyways, got a test based on the first one, and then somewhere in there had another close contact, a different close contact. So they kept telling us to wait a few days and then get the test. And then they kept coming back negative, and then to wait a few more days and do your final test. Anyway, so we had some sense of, I guess a few questions came out of it. Number one, we had this terror that we were, using more tests than should be used, that there's, some difficulties there. But the other thing was we got him boosted, and we were worried about what are the tests, which tests are going to read a false positive could read a false positive from a booster shot versus which one is going to be, is going to be pretty, isn't going to give you a false positive from a booster. Does that make sense?
Yeah, that's a really good question. So the booster or either vaccine will not cause you to have a positive test at all. Okay, so that is teaching your body, your immune responses to develop that spike protein that can fight the virus. So you're actually considered fully boosted as soon as you get that shot, as Dr. Nate says, as soon as the needle comes out of your arm, but it will not affect a test at all. So I'm sorry your child's been getting exposed so much. That's a bummer, but I know that there's quite a good quantity in Juneau of the over-the-counter tests available for taking home, correct?
Well, no. I mean, I think the library was giving them out, and they ran out. So I'm not sure if you're referring to the school district or just in the community.
Yeah, the school district I was thinking of.
Oh, yeah. So a lot of this was over the break, and
okay.
And I don't know. I don't want to spread misinformation, but just our personal experiences when we tried to get some for home, the libraries had already run out.
Okay.
So yeah, that was a week or 2 ago, so that could have remedied. Don't let me give misinformation.
Well,
okay.
My understanding is in the district there that if you're a close contact and you are your child's in the school, that there's still tests available for that they'll give out. So
great.
Yeah.
Thanks.
Yeah. Good question though. Really good question. Anybody else?
Barb, yeah, there's a question about if you or a child or a student has a COVID, how long should they wait to get boosted?
That's a really good question. Usually the healthcare providers say wait until you're out of isolation, your fever's been gone, your symptoms have decreased. So usually a minimum of 10 days. So yeah, I would probably wait myself just a little bit longer than that. But yeah, it's really awesome protection. You've actually had COVID and then you get boosted. It's probably one of the best protections, both your natural immunity and the immunity from the vaccine. Not that you want to get COVID, but right.
Great. Well, thank you so much, Barb, again. Did you see another message just came in from Cheryl with Rally down in Juneau? How long do you have to isolate after the fever has been gone?
24 hours. So you want to make sure that you haven't been taking Tylenol or ibuprofen. It's actually, a lot of the pediatricians recommend not using any of the fever reducing until for your children until the temp gets over 102 so that your body can fight that fever themselves. But yes, you want to wait 24 hours. Okay. So say you had a fever on day 5, you could have got out of quarantine. It continues to day 6. And then 24 hours after the fever goes down, then you can go back. You can enter quarantine.
Awesome. Thank you so much, Barb, for sharing. We will make sure to share the slides and this recording out with folks who weren't able to attend. And for any of you who might have been trying to jot down a lot of notes, we'll make sure again to send those out after today's meeting. Thank you, Barb.
You're welcome. And then make sure to refer to that CDC chart that was pulled up for the isolation and quarantine. You can make copies of that too and have that so you can refer to that, because sometimes you have to go through it a couple times to remember it. So, well, you're welcome, Thomas. It's great to see you again and see everybody. And thank you for helping all our kids. I love after school programs. So amazing.
Great. We are going to keep our meeting moving on. Wanted to next share about a new national partnership that we have that we're bringing to the network. So the National After School Association is the national, the National Association of Out of School Time Professionals. They are one of the kind of country's lead around program quality, around quality standards, core competencies, a wide variety of other things around boosting the power of after school. The Alaska currently, well, Alaska not so currently anymore because we are now the affiliate. Alaska has never had an affiliate before, so this means that Alaska residents and individuals like yourself, if you wanted to be affiliated to the National After School Association, you had to do that individually. By us being a network partner now, an affiliate of the National After School Association, there is kind of a mutual share there. So by being engaged in our after school network, you are now part of this broader national association. It also allows us to be the voice for Alaska at the national level when they're going through things on the national front around issues around quality standards, around professional development, around core competencies. It now gives Alaska a greater voice into that kind of national association of professionals. As part of the NAA affiliate as well, we will be providing all of you with ambassador level membership to the National After School Association. That includes things such as receiving their monthly, both their live ones and their archive professional development opportunities, NAA weekly newsletter, and discounts to their products and services, as well as trainings and publications. You'll start seeing more information from NAA being shared through our newsletter as well. They've had some really phenomenal material lately around creating greater equity in after school and diversity and inclusion inside of the workforce, especially inside of management. They've been publishing a lot of great information on there, as well as really trying to address the worker shortage. So you'll start seeing more information about NAA. We'll be reaching out to all of you. Well, we greatly value your data privacy. So we will be putting out an email asking if you'd like to receive information from NAA. If you don't, that is A-okay with me. We just want to provide that direct connection to you as well. Folks who are signing up in the future for our newsletter will have an option to sign up also to be connected to the affiliate status as well. So you'll be hearing more from us and seeing more kind of NAA materials and publications and trainings that we'll be sharing to bring to all of you. Any questions about the NAA affiliate?
I have one, Thomas.
Go ahead.
Does it affect attending conference? I know it's one of the deed approved conferences for 21st century. So does it affect like conference registration if we plan on going, or anything that NAM membership would include?
That is a great question, Marcy. Let me double check on that. I don't know that at the ambassador level. I don't think there's a discount at the executive level, which for NAA, if you wanted to do that, that would be a purchase. I believe that does, but let me get back to you on that, and I will double check for you around that NAA conference. Part of it, you will, if you do go to NAA's national convention, you'll start seeing our after school team there more often as part of our affiliate. We are required to go and connect in with the broader affiliate network. But Marcy, I'll get back to you around if there's a discount on the convention. I'm seeing what level of PD access might we see under the ambassador? Great question. So this is their kind of monthly professional development opportunities, as well as our archived ones. Their professional development opportunities predominantly geared towards entry level and developing level after school professionals. And this is brand new to us. We just started the affiliate as of January 1. So we will be finding out more information here this month when we have our first affiliate meeting with them. So we'll bring that information to you as well. So Courtney, I will flag that as a question that I will bring to the association.
Thank you, Thomas. And as a quick follow-up, do you think it would be possible to ask about some of the professional cohorting opportunities that they offer?
Yes, yeah, that is one of the other main reasons why they have several great opportunities that we want to make sure that we're making it available, including there has been several cohorts for emerging leaders of color to engage into. That by being an affiliate, we're able to help connect individuals here in Alaska to those and several other learning cohorts and communities. So we will be kind of sharing those out more readily as we are now kind of building that greater bridge to the National Association.
And do you mind clarifying or repeating for the weekly e-news? Do we all as individuals sign up for it? Are you guys going to receive it and forward it to us?
Great question, Jessica. So we are going to be in our newsletter. We'll put out a sign up for it because we again strive for kind of greater data privacy. So we will be putting out an ask to folks that you'll see if you are interested in us connecting you to the NAA affiliate. At that point, then we will share that list of Alaskans who said yes, they would like to. So that way you're connected that way. If you go onto NAA's website, you can sign up for it yourself as well and say that you are connected to the Alaska After School Network. And that will also connect you in well to getting that ambassador level. But we'll start sharing more of their kind of various resources and training events as well through our newsletter to keep folks up to date. Super. We're gonna keep our moving here. Next one, I'm gonna ask Lily, our STEM Vista member, to go ahead and share a little bit about our STEM needs assessment that we are finally launching today.
Yeah, finally. Yeah, so we've been working on this STEM needs assessment for you guys, and the goal, as it says, is to hear from all of you what we can be doing as a network in order to help expand or help you expand STEM learning and out of school time. So I guess I just want to emphasize that this is open to all out of school time providers, whether you are currently providing STEM or not. It's open to anyone who is doing after school or out of school time learning. It closes January 31st, which is a little over 2 weeks, I think. And of course, if you are a respondent, you are entered to win 4 possible $50 gift cards. So make sure you take advantage of that quick. Here, I'm going to add the link into the chat. Yeah, and we really want to hear from all of you about what more we could be doing as a network. So thank you so much in advance for filling that out.
And the one thing I will add, so when we are saying out of school time professionals, we are using a very broad definition of this. This is both paid and volunteer individuals working in group settings during the out of school time hours. This includes all of you, after school and summer providers, public libraries, science centers, STEM learning institutes, really the gamut of different programs, tribal youth programs, teen drop-in programs. We want to hear from a wide variety of out of school time providers on this survey, both managers and direct service staff as well. Our goal with this is really to help shape both what the network is doing around STEM, but to be able to really use this also to bring in new funders. We are increasingly getting approached by corporate donors that want to engage in out of school time, see it as a valuable resource for expanding STEM learning. But we really want to make sure that we're kind of shepherding and connecting those funds the right ways and right supports for all of you. So please provide that feedback. We greatly appreciate it and share with others. And you could win a gift card, which is always great. Thank you, Lily, for working on that. The next part that I wanted to share is we are starting a new work group, a licensed school-age childcare work group. This is specific work to those who are licensed school-age programs. So you're licensed by the state of Alaska or the municipality of Anchorage. Some of the key items right now that's kind of been prompting this. So we have been working with the state and the municipality of Anchorage, with Campfire really being the first group to do this. We were able to secure a variance, or Campfire was able to secure a variance to allow 16 and 17-year-olds to be counted towards full ratio. So those of you who aren't licensed programs may not know, but there is a ratio requirement by the state and by the municipality of Anchorage around the number of adult caregivers to students inside of a licensed program. And historically, they've had to be 18 and over. This variance is to really address the critical work shortage that is happening right now in Anchorage's licensed school age programs. We are working at about only a quarter of capacity because we just have not been able to hire staff. So our hope is really to open up programs by enrolling those high school age youth that will be supervised by an adult site leader to be able to help engage. So if you are a licensed school age program and you are interested in learning more about that variance process, please contact me and we'll connect you to a template to do that. This work group will also be focusing around integrating school age programs into the state's Learning Bureau, the QRS, Quality Recognition and Improvement System, as well as expanding access to SEED, system for early educator development, and the professional registry, as well as addressing the enrollment barriers that many are facing. And lastly, we'll also be starting to explore developing or reviewing licensing regulations to see if we would like to push towards having standalone school age specific licensing regulations, which I know many in the school age childcare field for years have really wanted to see this happen, to get out of being concerned about diapering and cribs and focus in on what's best for school age students. So if you're interested in this work group, please contact me. We'll be reaching out to all those licensed school age programs as well. Next, I'm going to turn it over to Anna and Aaron. They are going to share. We have a lot of professional development coming up per request from many of you. And they're going to also share some updates. Before they kind of share their part, though, what I wanted to point you to, you may have seen in our recent newsletter, and you will start seeing it more and more in our newsletter. We have a new events calendar. The goal with this events calendar is to help make a one-stop shop for you to find everything that is the after school network, or our meeting times and our trainings. So you will see on the events calendar right here, here we are today, there's our statewide call. If you click on that link, it will now take you to being able to add it onto your calendar. And it will also, that add onto your calendar will have the Zoom link to it. Say if you're interested in the training coming up next Friday, there is a link for it right there. So we are going to be really actively pushing you to this calendar. We will be putting all of our meetings and all of our trainings and other events, conference, you'll see on here as well, as those dates are set. So this will really be the hub of all of our events in professional development. And I am now going to turn it over to Aaron and Anna.
All right, so over the next 2 months, or the end of January and all through February, we are going to be offering all 10 youth worker methods workshops that were developed by the David P. Weichert Center. They're based on this pyramid of program quality that is very similar to Maslow's hierarchy of needs. So the things on the bottom, safe environment and supportive environment, are things that need to be in place before the upper 2 domains can be in place. So all 10 of those workshops are listed along the left-hand side. And they're all 2 hours from 9 a.m. to 11 a.m. on Tuesdays and Fridays, starting January 21st is the first one. Those will go all through the end of February. Next slide. So just what we have going on for the rest of January, our first youth worker methods workshop is Intro to the Active Participatory Approach, which will be on the 21st, which is at the same time as our STEM curriculum Leap into Science Balance workshop. And then our second youth methods workshop is Structuring Clear Limits on the 25th. And then on January 27th, Eliza Muse with the Office of Substance Abuse and Prevention is doing a webinar on substance misuse and how they're using the YRBS data with that. And then our next youth work methods workshop is on January 28th. And you can find the rest of those on our calendar.
Great, thank you, Aaron. So again, we are just strongly encouraging. The calendar is like, I normally get folks being like, I can't find the link for this event. Well, we are trying to centralize it all on our website now. If you are looking for, again, that link, I think it's one of our team members. I'm not sure if you put it in the chat, but if you would, please do. It is the events tab underneath About Us. If you can't remember where it is, akafterschool.org/events, or you just go underneath our About Us and you find it there as well. All right.
Thomas, can I jump in with youth mental health? I don't think this slide updated.
Okay, go ahead.
So I will drop these dates in the chat. It looks like this slide did an update on there. So also we have coming up a few youth mental health first aid trainings. We have one on February 24th from 9 to 3 p.m. as well as May 26th, 9 to 3 p.m. And Lily, you might not have the link, so I will drop those too since it didn't update. But they are also on the calendar if you are interested in attending either of those trainings. With those trainings, it is about, I believe it's about 2 hours of pre-work the week prior, and you would have to complete the pre-work in order to attend the live training. So it is a little bit of a time commitment, but the trainings have been great, and they're facilitated by Wendy Shackelford. Yeah, Jane, they're great. So with that said, there are 2 coming up. We know the need is great and the demand is large. So a couple of the Alaska Network staff, myself and Aaron, most likely are hoping to get trained in the TOT, hopefully in the very near future. We have a lot going on, so we're hoping to get this TOT so that we are able to offer more trainings outside of the 2 that are coming up. So that we have an idea of, where the need is. We were just going to see if we could gauge interest, if there is interest in any additional training dates. So we are pretty flexible with when those are. So if you can just drop in the chat, if the school year, if there's a, time during the school year that's better, or if summer months are better for you, or your staff to attend a youth mental health first aid training, just let us know in the chat, and then we can plan kind of what works best for everybody.
Thank you, Anna. Would love to hear from folks too. I know we asked this, I think, in our September meeting. Wanted to see if folks are still interested. So Anna, Anna's been doing a great job coordinating these trainings. They have been very full. They are a capped training for the number of training spots. So we're going to encourage, make sure if someone is from your team or you are signing up that you're able to commit to that time for the training, because if you're not able to show up, then that's a spot missed out by someone else. And we have had a wait list for all the trainings. As we also mentioned in September, so Anna and Aaron are going to get the TOT so that we just can have more trainings because we know many of you have been requesting it. The other thing that we are going to be doing is we are still trying to work on getting some of you trained as well in youth mental health first aid as well. So if you are interested in that, if you could please email Anna or myself. We do have a list of some of you who said this past fall that you would be potentially interested in the TOT. But if you have someone in your agency that commit to doing training for your staff and potentially for other community members or after school providers, we'd love to be able to expand that resource for you. The other piece I did see in the chat box Marcy put around are the event calendars just for the network. That's a good question that I'm going to put out to all of you. If would you like to see as well on the events if there are other trainings that you're hosting? So like Marcy put in that she has some trainings that are open to folks. Would you like to see those trainings kind of open more broadly as well for folks to be able to cross share and post? If you could put in the chat if you would like that, or if you'd like to just keep it network specific. We could also code them if need be. We'll give folks time to think about that. You can also let me know one-on-one as well. I'm gonna pull back up our slides here to keep myself on track because we're almost out of time. The last item that I wanted to share, this is my partner share out. The I Love After School, or I Love, yes, thank you. The I Love After School campaign is going to be starting to gear up. This is an annual kind of just fun way of celebrating and raising awareness around after school. We're encouraging you. There is the little paper flyer that you'll see on the link that we'll put in the chat box here from the After School Alliance that you can print out and have your students write or draw why they love after school. This is from the Nikiski Boys and Girls Club. I love this group of kiddos there with their posters. This is also a great way of having parents as well. This is just a fun way of sharing the story on why people love after school and why students and families love after school. So we're going to encourage you all to participate in this. It is a good time to just keep the momentum rolling around out of school time. We're going to ask you, please tag us, AK After School, on social media, Facebook, Instagram, or Twitter. Or you can also email me directly because we'd love to share out some of your photos. I know in the past we've had some from Bristol Bay, some from Fairbanks, some from Kenai Boys and Girls Club. So please pass those along to us as well. Love to be able to share your pieces. Lastly, we're going to just open up the floor for our partner share. Before we do that, though, a reminder, March 10th is our next statewide call. But we're going to open up the floor right now for anyone who has a partner share that they would like to share out a highlight, success, a challenge, or anything you would like to ask your peers. I see Karen's putting something in. Karen, do you want to jump off mute?
Sure. I just want to make sure people are aware that we've extended the deadline for Spirit of Youth nominations to February 1st. I know a lot of you may have this Monday coming, this upcoming Monday off for MLK Day. It might be a good day for you to sit back and think about a young person who whose efforts might have gone unnoticed this year that you can recognize.
Now more than ever, it's so important to recognize young people, especially as we know depression, anxiety, and isolation has been a very real factor for all of us, especially our young people. It's a great way of letting them know that someone in the community sees them, cares about them, and sees them as worthy. So it's a great way of helping support young people. Any other partner shares, trainings, or other announcements or things you'd like to ask your peers?
Yeah, this is Rhonda with 4-H. I just wanted to say that Alaska 4-H in all the districts has a lot of interesting programs going on this semester. They're mixed variations. There's a lot that can be joined by Zoom and everything. There's some stuff that we're doing statewide. We're doing Open Heart. We're doing Youth and Governance. If they want to join in to go to Juneau, I think that one's online. But Youth and Governance is a good one. They get to interact with their legislators. And we're going to start a drumming one as well, some music education. So you can check alaska4h.org, and depending on your district or statewide stuff, it's all there. But some very interesting stuff coming up this semester.
Awesome, thanks, Rhonda. And I think Alaska 4-H is also hiring right now.
Yes, lots.
If you do have any other employment openings in that, please send them our way for our after schools hiring. If you have been on social media lately, you may have seen our videos popping up. We're going to be doing another round of after schools hiring videos and promotions. As well, we are working with Cook Inlet Tribal Council on connecting all of you who are hiring right now to a job fair coming up in March. It's a virtual statewide job fair, and we are exploring the option of potentially also doing a summer job fair specific to summer youth programs. So we'll keep you in the loop on all those via our newsletter and the March statewide call. All right, if nothing else, I wish you all the best in 2022. Stay happy and well, and we will hear from you soon. Thank you all for joining us, and we'll connect whenever you need us. Talk to you soon. Bye-bye.